Good afternoon, everyone. I do want to welcome you. My name is Don Gettinger, and I'm a Quality Improvement Specialist here at QSource. On behalf of the QSource team and the Indiana State Department of Health, I would like to welcome you to today's webinar, Decreasing Opioid-Related Adverse Drug Events. Our learning sessions today learning sessions that we have throughout the year aim to educate, promote, and protect the health of people in our communities where we live, work, and learn together. We work toward this goal by trying to prevent illness and diseases, by increasing awareness and promoting healthy behaviors. We can also reach our goals by educating ourselves and others about emerging public health issues, detecting disease patterns, and social determinants of health risks. During today's session, our speakers will be discussing Indiana Department of Health surveillance activities, including the drug overdose dashboard, prevention strategies, and opportunities for partnership and collaboration in our communities. Next slide, please. So briefly, our agenda today includes these opening remarks, and then we'll go to our featured presentation. Then there'll be an opportunity for questions and answers, and then we'll have some closing remarks. Before we begin, though, I do want to run through a few housekeeping items. First, we do have all the lines and microphones muted at this time, but we'll be opening both during today's webinar when the Q&A portion begins. Additionally, we have a question and chat feature, which you can access usually on the right side of your screen. And today, Kathy Ray from QSource will be monitoring that chat as we move through the presentation. So if at any time you have a question or a comment, please put it there in the chat. The interaction is great. If it's a question, we'll definitely respond to it, either in the chat if it's something that we can answer or on the call during the Q&A time. We also encourage you to monitor the chat function because Kathy will be putting some information and resources there as well. Next slide. As you know, QSource is the Quality Innovation Network Quality Improvement Organization for Indiana. We convene, teach, and inform healthcare providers, engage and empower patients, and inspire the entire healthcare continuum by sharing knowledge and spreading best practices. I want to thank you for taking the time to join us today, and we appreciate all of you and your dedication to improve quality and achieve better outcomes in health and healthcare at lower costs for patients in the communities we serve. As referenced earlier today, the question and answer is today's session is one of our many monthly webinars, and that will be hosted by QSource. And each session is made available on demand that you can share with your peers or listen to later if there's something that you have a question about. Today's session will be made available as well. It's my pleasure to introduce our speakers today. One of our speakers is Camille Anderson, and she is the Drug Overdose Prevention Outreach Coordinator with the Indiana Department of Health. Camille has been with the IDOH for just under a year, and she joined IDOH with a wealth of experience, which includes child welfare, state and local prevention, mental health and addiction support, and leadership. As the Drug Overdose Prevention Outreach Coordinator, Camille supports the southern counties in Indiana who were awarded funding through IN Cares ECHO to implement and enhance drug overdose prevention efforts in rural communities. Our other speaker today is Cameron Longberry. Cameron is the Drug Overdose Prevention Community Outreach Coordinator with the Indiana Department of Health, and she joined IDOH last September with previous experience in fetal and infant mortality, safe sleep education, and community health. As a drug overdose prevention outreach coordinator, Cameron acts as a liaison between IDOH and the northern counties in Indiana, which are part of the IN Cares ECHO program as well. So it's a pleasure to have both of these speakers with us today. And now I'm going to turn it over to you, Cameron.
Awesome. Thank you so much, Don. All righty, everybody. I just want to thank everybody for joining us today as we talk about the drug overdose prevention programs for IDOH. We'll be kind of covering substance use surveillance and prevention today. So our mission over at the Indiana Department of Health is to promote, protect, and improve the health and safety of all Hoosiers with a vision for every Hoosier to reach optimal health regardless of where they live, learn, work, or play. I know that Don gave us a great introduction a little bit ago, but I'll just run over it one more time. My name is Cameron Longberry. I'm the Drug Overdose Prevention Community Outreach Coordinator for the northern half of the state. My partner Camille Anderson is on here today. She's also a drug overdose prevention community outreach coordinator for the southern half of the state. She'll be jumping onto this presentation a little bit later and kind of helping me out. Alrighty, so both Camille and I work for the Division of Trauma and Injury Prevention at the Indiana Department of Health, with a mission that works to develop, implement, and provide oversight of a statewide comprehensive trauma care system that prevents injuries, saves lives, and improves the care and outcomes of trauma patients. So within the floor of trauma and injury prevention, we kind of have two main sectors. We have a team of people that really focus on trauma and injury prevention related activities. Some of their programs include things such as car seat safety, older adult falls, a lot of more interesting programs that I cannot remember off the top of my head right now. But then the other half kind of our team works with specifically drug overdose prevention and activities related to drug overdose prevention. And that's kind of what we'll be focusing more on today. So essentially every drug overdose prevention related activity that we have is funded through the Center for Disease Control's grant called the Overdose Data to Action Grant, OD2A for short. This was a grant that was given to 66 different jurisdictions across the country. Was originally awarded in September of 2019 for a 3-year grant period, but we got a 1-year extension due to the pandemic. So this grant cycle will be ending August 31st of this year. And we actually just applied for the next round of OD2A, so we are anxiously awaiting to kind of hear back about what that will be. But essentially, OD2A supports jurisdictions in collecting high-quality, comprehensive, and timely data on both non-fatal and fatal overdoses, and using that data to inform prevention and response efforts. So kind of the main goals and purposes of this OD2A grant has been kind of broken up into 10 different strategies, with 4 of those strategies that focus a lot on surveillance efforts, and then the other 6 focusing on prevention. For this seminar alone today, we'll kind of be focusing more on the surveillance strategies. Camille will kind of jump into a little bit of the prevention efforts that we have. I wish that we had hours and hours so I could talk to you all about the prevention strategies as well, but for now we'll be focusing more on surveillance. Alrighty, so jumping into strategy 1 of the drug overdose surveillance initiatives. Strategy 1 focuses on collecting and disseminating timely emergency department data on all suspected drug, opioid, heroin, and stimulant overdoses. One of the ways that we do this is through a program called ESSENCE. ESSENCE stands for Electronic Surveillance Systems for the Early Notification of Community-Based Epidemics. That is a mouthful, so we do go for ESSENCE for short, definitely. What ESSENCE is essentially an alert system that focuses on trends found in emergency department chief complaints. So if there happens to be a large spike in an area that's related to drug overdose chief complaints, if there's a large spike, then that spike and alert will get sent to our overdose surveillance systems epidemiologist. Her name is Shelby Neerman. Then Shelby kind of works to alert the local health departments and hospitals in that area where the spike originally occurred and provides them with information regarding what substances seem to be spiking the most. Alrighty, moving on to strategy 2 of the drug overdose surveillance initiatives. This is SUITR's data. SUITR stands for State Unintentional Drug Overdose Reporting System. They kind of work to collect and abstract data for unintentional and undetermined intent drug overdose. They get all this information from the death certificates, coroner reports, toxicology findings, autopsy reports, and they take this information from these reports and upload them into the CDC-based SUITR's system. That's kind of like a web-based system for people that have access to it. They put all of this information in there, and then this kind of helps them to identify trends of substance use and kind of help create further drug overdose prevention activities. Strategy 3 focuses on the pilot of the syringe analysis program that we have. This essentially was a collaboration with Marion County Health Department through the OD2A grant to kind of work with the Indiana Department of Health labs. So essentially all of the used syringes from Marion County's Syringe Services Program are sent to the Indiana Department of Health labs, and those syringes are kind of analyzed to determine substances that are being used more frequently. Unfortunately, at this point, because that sample size is so small, with it just coming from Marion County's Syringe Services Program, this data isn't shareable statewide yet. But with this new round of OD2A that we had just applied for, we're kind of looking to expand to all 8 of these syringe services programs within the state. That way we can kind of have some more data on this and hopefully be able to share it. Strategy 4 focuses on the Inspect prescription drug monitoring program. Essentially what Inspect is a drug monitoring program that is housed under the Indiana Professional Licensing Agency, IPLA. It kind of requires that any provider that prescribes reportable medications are required to put that into the state prescription monitoring program database. This is essentially a monitoring strategy that works to prevent people that suffer with substance use disorder, kind of prevents them from doctor shopping, and it also prevents providers from overprescribing dangerous medications such as opioids that we know are highly addictive. All right, jumping to strategy 10, this focuses on toxicology reporting from funding from IDOH that runs toxicology on all suspected overdose deaths since July of 2018. This kind of works to find county-specific related trends of drug usage. And if you kind of look over on the right side of the screen here, all of that really long verbiage that I don't think anybody wants to read, that is actually a state law that requires that coroners and medical examiners send toxicology reports to the state. And then that toxicology reporting that is sent to us is abstracted with the suitors team. And they put all of that data into that CDC suitor system that I was kind of talking about back in strategy 2. And this is all used to kind of further identify trends with substances. All of our surveillance efforts kind of work to identify substance use trends so that we can create further prevention activities. So strategy 10 and strategy 2, I would say, are kind of related, kind of go hand in hand a little bit. Alrighty, moving on to our Indiana drug overdose dashboard. This is a really cool dashboard that was actually a collaboration between the internal and external partners of the Indiana Department of Health. This dashboard kind of works to provide information on drug overdose related injuries, opioid prescriptions, and all of the prevention efforts that are going on across the state. I just realized that I don't think I put in the actual link to the Indiana drug overdose dashboard here, which I may be able to put that in the chat really quick, or if you Google Indiana drug overdose dashboard, it's the first link that comes up on IDOH's website. But this is an incredibly useful tool because it kind of shows what each county has to offer in regards to their county response to drug overdose. It shows every program that each county in Indiana offers. It shows how many overdoses that they're dealing with, opioid prescriptions, and you can kind of see what struggle each county is facing in regards to this overdose epidemic. And kind of shows you again like what programs they're putting in place to kind of prevent these type of things from happening. So if you ever have time to just go in and play around with it, and it's an incredibly cool and useful tool to see. At this time, we're kind of going to be moving into more of the prevention efforts of things. So I will pass the baton over to my partner Camille here.
All right, thank you, Cameron. So I am going to talk about the drug overdose prevention initiatives that are here at IDOH. Again, all of the surveillance activities that Cameron just talked about help to inform some of these prevention efforts across the state. The first one I'm going to talk about is harm reduction. We see harm reduction through providing naloxone education, training, and distribution. We do partner with the local health departments and also the first aid responders. We also increase the expansion of peer recovery coaches across the state of Indiana. And then we also support the overdose prevention therapy, which is Indiana Opt-in, and that is the naloxone distribution registry and locator to connect substance users to naloxone and treatment resources. Lastly, under harm reduction, we have the safe syringe services and non-syringe services, and we do have those in 21 counties across the state. We also provide provider education as we partner with IU Health medical echo teams and provide education on hepatitis C, HIV, integrated pain management, LGBTQ plus, and also additional health education as well. Cameron, you can go on. Additional initiatives include the Indiana Community Advancing Recovery Efforts, which is the NCARES ECHO. That is the program that Cameron and I both work under and support currently. And the ECHO is enhancing community healthcare outcomes. So it brings together leaders in key sectors within the community. So these are the health professionals, the educators, also the service providers, all coming together to come up with ideas to inform prevention efforts, but also as a hub of education for those who are serving the community as well. So currently we are working with 14 counties working to build capacity and implement local prevention efforts. That's where Cameron and I come in. As you see, she covers the northern part of the state and I cover the southern part of the state. So we split those up between, we both have 7 counties that we work with who are implementing NCARES ECHO in their communities. Also, we have the suicide and overdose fatality review teams. So we're working to prevent further suicide and overdose deaths by conducting a series of confidential case reviews. So this is where communities come together. Again, we try to bring to the table all of the service providers. So we have the coroners, the emergency departments, the local health departments, and the service providers. Those communities brings those individuals together and do case review for both suicides and overdoses. And through these reviews, again, is how we help to inform programs so we can learn what trends that we're seeing in the community. They also do family stories as well, so families can have an input on some of the things that are going on, and also further make sure that we have the adequate information we need so we can better inform programs, policies, and practices across the state in regards to suicide and overdose prevention. Next slide. And then we have the naloxone distribution that is supported by the Indiana Department of Health. We have grant funding opportunities that allow the distribution of opioid rescue kits in the form of Narcan nasal spray. We do partner with local health departments that can apply for funding to become a naloxone distribution site. We also allow funding to go to, first responders as well. So we, again, partner with the local health departments and first responders to make sure that they are equipped to respond to overdoses and also to distribute Narcan in the communities that they are working in as well. Also, with the naloxone distribution, we have mobile outreach. So we have the mobile integrated response teams. And this is a systematic approach to integrate it with the mobile response teams that consist of a peer recovery coach. So we do make sure that individuals, as they are responding to fatal overdoses, that a peer recovery coach is there to provide support to the family or to the individual if it is a non-fatal overdose. Clinicians, also first responders, prescribers, and law enforcement as well. We provide them with naloxone so they can provide naloxone to clients through their encounters. Many teams also partner to have nalox boxes and also nalox vending machines in their communities as well. We also have the harm reduction street outreach teams, the HRSO, which are outreach teams that distribute kits in the areas where drug usage may be occurring, such as parks, hotels, gas stations, smoke shops as well. And then we also, through this, provide not only naloxone, but fentanyl testing strips as well in the harm reduction kits. So teams also distribute wound care supplies, safe use supplies, and basic hygiene through the HRSO teams. And that is in partnership with FSSA as well. Also, we support the no contact options, which include naloxone vending machines that you can see in many places across the state, the nalox boxes, also direct mail. So if any individual wants to receive naloxone through direct mail, that is an option, and services provided in partnership with Overdose Lifeline. So we do partner with Overdose Lifeline to continue the distribution of naloxone across the state. Currently, as you see on here, you can see some of the data that has been collected from some of our outreach and prevention efforts. So this data is from October of 2022 to March of 2023. So you can see in total, we have distributed over 115,000 doses of naloxone through this prevention program. All right, and that is actually all for us. If you have any questions and related to NCARES ECHO prevention efforts, you can always contact myself or Cameron. Our information is there. If you are needing any information about suitors or any data related information, Allison Lake is our epidemiologist that works with our team. Any Essence related data as far as spikes in your community, you can always contact Shelby Neerman, and she updates that dashboard as well, located on our website.
Thank you, Camille and Cameron. That was a lot of great information. I know I have a couple questions, and I will see what questions we have out there, either in chat, or if you would like, you can ask for your phone to be unmuted. You can ask that question on the call using your phone or computer microphone. So do we have any questions submitted at this time?
I do see that there's one question in the chat. What counties are you doing street outreach in? I don't have a list of the counties that we are providing street outreach in. Again, this is in partnership with FSSA through the HRSO. I know that they do have street outreach teams here in Marion County. Also, I do know that they have them in Lake County and Lafayette. Those are the only counties that I know off the top of my head. But if you want that information, we can definitely get that to you. I think it's Elisa who had that question in the chat.
And Elisa, if you will want, like if you're looking for specific counties, you can just put those counties in there and we'll be able to see it, to ask if they have them in those counties as well.
Yes.
Okay. Are there any other questions? I don't see any others in the chat. There's Wayne County was the.
I'm not sure, but I can definitely see if I can find the information for you very quickly.
Perfect. All right. While you're doing that, and just see if anyone else has some questions in the questions, either to put in the chat or to come on. You talked about the ECHO program. Is that available for anyone in the state to join right now, or is that just, again, specific areas?
So technically it is available for any county in the state to join, but they do have to apply for it because that comes from the funding that we have from OD2A. So the ECHO counties that we deal with right now, the 14 ones that we kind of house in this program, their funding will run out the exact same time that our original OD2A grant will run out, which is August 31st. And then we'll be kind of giving out some more information regarding that open application status to be able to become an NCARES ECHO county. Every county kind of has to apply, and based on, you know, what those counties' needs are and kind of what their drug overdose responses are looking like, then we kind of sift through and pick counties to give funding from that.
There's a question that's come in. Who has access to Essence, and is that only for health providers?
At this time, the only people that have access to Essence are Shelby Neerman, as well as hospitals and local health departments.
I don't see any other questions online. For our speakers, is there anything else you wanted to share, or you think that's really important to that you wanted to highlight? Just wanted to give you a chance to cap things off if there's kind of important points you really want to make sure that we get across.
Yes, we just say again, if you ever have any questions, if you ever need any data or anything, please feel free to reach out to us at the health department. At the Indiana Department of Health at any time. We love to assist your communities in any way possible, and we do support the outreach efforts across the state. So again, just at any time, if you have any questions, any concerns, feel free to email. You can email myself or Cameron. And if we don't know the answer, we will be sure to make sure we get a response for you in a timely manner.
Perfect. I do see one more question has come in on the chat asking where are naloxone boxes located? And really, I think maybe what might be more helpful is just kind of what types of places are the naloxone boxes, kind of what type of places do you see those going in at?
So a lot of times you will find them at local recovery centers, some of the local churches. Oftentimes, communities like to place them in hot spots, so in areas that they know have high drug use rates, high overdose rates, are typically the places in which you will see them. But right now, we see a lot of them partner with community centers, their local health departments, also local churches as well. And if you know anyone who would like a naloxone box, again, you can reach out to us at IDOH and we can connect you with the right individuals to get a naloxone box at a location that you are aware of.
I do have actually a question that came in directly to me asking if you have any information about xylazine, which is kind of a new substance that we're seeing in some of the overdoses. So I don't know if there's any information you have that you could share on that. That would be great.
Yes, we do have information. It is posted on our website. We can also, if you drop your email in the chat, I can also send whoever is wanting that information that we do have. Again, it is a new emergence, so we're still collecting data and research, but what we do have, we are able to share out to the community.
So again, QSource brings together Medicare beneficiaries, providers, and communities in data-driven initiatives that increase patient safety, make communities healthier, better coordinate post-hospital care, and improve clinical quality. You can see those communities there on the map. We often refer to these as our community coalitions or partnerships for community health. We would welcome you to join us in those coalition meetings and reach out to us if you're interested in participating in those meetings. So again, next slide. We'd also like to welcome you to join us at upcoming webinar events. We do have one coming up on recruitment and retention, and then one in August on pneumococcal vaccine and the CHIRP system. So we're continuing to bring these information and question and answer sessions out to you at least monthly. And we encourage you to register for those on the QSource website, or you can reach out to us if you're not able to find that, and we'll help you get registered. You can also, if you go to the next slide, you can find resources from QSource at our website. The QR code right there, you can scan and get to it directly, or you can get there through qsource.org and go to our resources page. I like the QR code because it takes you directly there, and there's a lot of free resources addressing both the topic of today's call about opioids, reducing overdoses, but also many of the other topics that we cover, including readmissions, chronic disease, care coordination, and a lot of other topics. So you can find more than 180 resources, podcasts, and previous webinars, as well as sign up for our monthly newsletter at that link. And then finally, if we go to our next slide, you can follow us on our socials, Facebook, Twitter, LinkedIn, and Pinterest. I want to thank you all for joining us today, and we wish everyone a great afternoon. Thank you.